Last week, the province announced its roadmap for reopening. Niagara West MPP Sam Oosterhoff joins us. He'll discuss what to expect as the summer months progress. Sam, first off, why was it decided to move away from the previous color-coded system?
Yeah, well, I think there's been a difference in this approach because we're in a bit of a different situation. We've gone through 3 waves now. In all the other waves, we didn't have a critical mass of vaccines to stop hospitalizations, severe symptoms, and of course, deaths. What we do have now is access to a life-saving vaccine, one that we've seen has been remarkably effective in long-term care homes and in other settings at reducing severe hospitalization, reducing death, and in fact, in many cases, just providing an incredible level of protection. And with that in mind, we do believe that coming out of this third wave, we see a sustainable path to a permanent exit. If we can ensure that the variants are kept at bay, if we can ensure that there's critical levels of vaccinations. And so as we move out of this particular wave and into a reopening strategy, we want to make sure that it's sectoral based, that we're reopening instead of just on an area by area perspective, but really as those key numbers and metrics are hit, both around ICU capacity and the vaccination rate, it's a game changer. And it means that we're able to come out of this stronger and more permanently than we have in the past.
Does this new plan still leave you the chance to put on the brakes in a specific region if necessary?
It's a cautious plan, and the Premier obviously has said since day one that he's going to continue to take the advice of Dr. Williams, the Chief Medical Officer of Health, who also is in constant communication through the COVID-19 command table with local medical officers of health. And I'm very confident that whether it's Dr. Hergy here in Niagara or medical officers in the other 32 public health units across the province, their voice is going to be incredibly important going forward. But we also recognize that, it's a cautious plan that ensures that we're able to see the results of the loosening of restrictions before we move into the next phase. So in the 3-phase part of the plan that has been released so far, we see some of these metrics coming into place with 21-day windows. And that gives time for the incubation period to kick in. So once we go into phase 1, as we see the impacts of those reopenings starting to come through the numbers, we're able to see what things look like before going to the next stage, as opposed to, more what we saw in March, where more things were reopening. And unfortunately, that did lead to a surge and we had to go back into lockdowns, which I don't think anybody wants to see.
Of course not. The 21 days relates to the incubation period of the vaccinations, and vaccinations have been increasing in numbers, and really the movement from stage to stage is tied to those vaccination numbers quite heavily.
It's a key factor. I don't want to say it's the only one. We still have the asterisks on there that says we have to look at ICU capacity and reduced hospitalizations as well. Ultimately, we know that eventually this will be endemic. We're not going to see absolutely 0 cases ever, but we also understand that when someone is vaccinated, the chances of their hospitalization are essentially 0 for all intents and purposes. There are, of course, exceptions, but for the most part. And so that has a huge impact on the ability of the healthcare system to handle those cases. And it has a huge impact on the ability of the healthcare system to be able to transition as we move into new phases. Restarting surgeries is happening again. We're able to see more of these things come back online. So yes, those 21 days is tied also to the vaccinations and the 2 weeks it takes to come into effect, but also seeing the case numbers that come out of that move into the next phase and more reopening of society.
Things look promising right now here in Niagara with the case numbers trending downwards, vaccination rate trending upwards. Do you think we'll be able to move into that next stage on June 14th?
I'm very confident that we will. I think we've seen the vaccination numbers, especially now that we have received supply from the federal government. We were obviously behind the 8 ball earlier in the year, looking at January, February, even into March, compared to some of our other OECD partners, especially looking at the United States. But what I think we've really seen here in Canada now is an uptake. We're seeing that people are stepping forward. They are signing up eagerly for that shot, and that's good news. Because that, of course, reduces the amount of hospitalizations and ultimately deaths, which is something we all want to see. And it allows for that capacity to be there to take care of someone who has a heart attack, someone who gets into a car accident, all these things that we don't necessarily think of right away, but are also impacted when someone is in an ICU with COVID as well. So I am feeling confident, of course, recognizing that, again, it is a cautious plan, but it's one that we believe is sustainable. And I think that's a key difference that we want to really emphasize that we want to make sure when we're out, we're out. We don't want to be going in and out.
If we do hit those targets and are able to move to the next stage on June 14th, that will welcome people back to patios seated in groups of 4, correct?
That's correct. That's one of the aspects. There are a number of different activities. Gathering sizes start to increase. We start to see more. We start to see indoor gatherings, which weren't the case even after this weekend. We see outdoor gathering sizes begin to increase. Non-essential retail. We see outdoor worship for religious gatherings. And then, of course, into phase 2, we see a number of more restrictions being lifted, the percentage capacity, some other activities. And I know that the details of phase 3 are intentionally a little bit vague because obviously that's still a ways away, and we'll see more details being unrolled as to what that looks like. But I think really in phase 3, we'll start being able to go back to a lot of those activities that make summers just some of the best things ever when it comes to living here in Niagara, right? Being able to take in a show, being able to partake in a live sporting event, being able to get back to a lot of those things that we cherish as human beings, that interaction that's so necessary, and of course the economic activity and the jobs that come along with it.
Any chance we'll see schools reopen as we head into June, the last month of the school year?
There are ongoing conversations. We recognize how important schools are. We recognize how important it is for students and families alike, and we'll continue to have those conversations and work with our partners.
Sam, thanks for joining us today. Thanks for providing some clarity.